Next up is a project called the Born Project, which is co-founded by Annamarie Saarinen, who's coming up. And 8 babies die every minute. And a lot of times it's due to lack of any kind of intervention in those first few hours. And so we welcome Annamarie to the stage to talk a little bit about that. She's got an amazing thing she's going to show you on her phone in a minute, but we'll do that in a sec. Okay, welcome.
Wait, I got one. Yeah, I got one less hand than I need. Okay, go. Just push that one aside. Thank you so much. Wow, what a special honor to be here, and congratulations to the other presenters tonight. You're doing a great job. Didn't make me any less nervous, but you're doing a great job. So we have the project that we started in Minnesota called the Born Project, which has its roots in the Midwest with a little baby who was diagnosed with critical congenital heart disease at 2 days old. She was entirely asymptomatic, but she was in profound heart failure, being sent away from the hospital. And that was my daughter, Eve, my 3rd child. So we thought everything looked great, but she indeed was not doing very well. Wow, this clicker is super sensitive. You're right. The other one doesn't work and this one moves ahead. So because of her situation, we were able to start exploring how a little red beam of light could actually reduce the chance that a child could leave the newborn nursery undetected with a very serious heart problem or other health condition. And that red beam of light is actually pulse oximetry. It's been around a pretty long time, actually, about 25 years, so commonly used that most doctors refer to it as the 5th vital sign. But it wasn't being used on newborns for whatever the reason. And we had a lot of babies, actually 1 in 3 in the newborn nursery, that were leaving hospitals right here in the US undiagnosed. So once we got our pilot up and running, we were able to approach the federal government here in the US to look at how this screening tool can be used as an early diagnostic. And within about 18 months, we were able to have the US Department of Health and Human Services make a recommendation that all newborns in the United States should be screened for congenital heart disease using pulse oximetry. So this is a test that has so far saved an estimated 3,200 newborn lives in the United States for about the cost of a diaper change in the newborn nursery. So the technology, while widely accessible in NICUs and in well-resourced areas, wasn't available in a platform that was sort of affordable and accessible. And we were able to team up with industry to co-launch and co-develop the world's first mobile phone pulse oximeter. That reduced the cost of pulse oximetry screening considerably. It was a 10x solution, basically brought down the cost by 10-fold, and increased access by, they're just sort of jumping ahead on their own, and increased access by 10 squared, so about 100-fold. Getting it into the field has been just a really an incredible opportunity for us. This is from last week in Sichuan province, where we are already in implementation. We have a screening program there that is screening about 78,000 babies across 50 different delivery sites. This is a very resource-poor area, but thus far we've had remarkable implementation success with this device in partnership with the government at the municipal and provincial and national level, and with clinicians countrywide who have really shown a keen interest in how this can actually help detect secondary conditions such as pneumonia and sepsis, which are the number 2 killers of newborns around the world, claiming about 1 million lives annually. So that became our sort of target condition as we look into low resource settings, and we've been really excited to see the results coming through. So data collection and data communication have been a critical part of this project. That's the beauty of a mobile health platform. And I don't know if they've been able to see like what's showing up on there. I'm sure oh, look at my heart rate. That's pretty much what a newborn is like. Because, yeah. So doctors, don't be alarmed.
I think we're going to zoom in off the camera.
Yeah. Yeah, so it's actually really great. It's got the same sensitivity and specificity as a hospital-grade pulse oximeter. But what it's calculating there is that my blood is really well oxygenated, so it's at 100%, exactly where we want it to be. My heart rate is ridiculously high. And then the perfusion index... Yeah, exactly. Like the alarm would be going off if I had the sound on it right now. But then if you just click on the middle button, what it does is monitor over any given time. We can send just the screening result or the like 1 hour, 6 hours monitoring on a baby who might seem ill. And then on this last one, if the frontline health worker in the low resource setting, yep, that one. And then if you hit the email button, it just takes that data that you just saw, puts it into a little CSV file. You don't even need Wi-Fi. This is just a cell signal. You hit that button, it sends it wherever it needs to go to the next nearest primary care physician or someone who can say, okay, here's what I'm seeing with this baby, definitely hypoxemic, you want to refer and transfer. So there's where the sort of infrastructure investments need to happen. Okay, so I have to go back to this slide. So this is what we're sort of looking for. A $2 million investment actually is going to, at this point, scale screening to about 10% of all newborns, so 13 million babies born each year. And then we also need to leverage both existing and new partnerships, both governmental and private sector, for impact and greater ROI. I mean, this could be, we're ecosystem driven. This is about what the treatment infrastructure looks like, how we can get these kids to proper care, using Susan's drones to deliver amoxicillin to babies who have sepsis or pneumonia. Right on, to raise your hand. That's like such a great opportunity to do so much more with this. And then empathy, understanding that every death is preventable. These are all the places where pilots are happening. And that is the opportunity we have to save 1,200 lives a day for the rest of the Sustainable Development Goals. And lastly, my daughter, if she were born anywhere in 95% of the rest of the world, she would be dead today. So I really, really thank you for letting me share her story and our work, and I hope to talk to you more after.
Incredible.